Welcome to Medical Spanish with Michael. I'm Michael, a medical interpreter and tutor that wants to help you learn medical Spanish. I'm fluent in 4 languages and actually learning my 5th language, French. And I found that by memorizing a handful of very important phrases, you can actually start speaking a language without having much knowledge of grammar or vocabulary in your target language. So yeah, without further ado, I've handpicked this list of 10 essential phrases so that you can have your first conversation in medical Spanish. Let's get started. All right, so phrase number 1. Should be no surprise here. To say hello in Spanish, we say hola, and making sure that that is a silent H, not hola. Hola, and then the name of the patient. Hola and el nombre del paciente. For example, hola Carlos or hola Maria. And then, depending on the time of day, you could say buenos días, good morning, or buenas tardes, good afternoon, or buenas noches, good evening, if you're working the night shift perhaps. So putting it all together, for example, we could say hola Carlos, buenos días. We could say hola Maria, buenas tardes. Notice that there is an A in buenas tardes and buenas noches. So for the afternoon and for the evening, we have an A because those are feminine words, the afternoon and the evening. But it's buenos días because that is masculine. Okay, so phrase number 2 would be to say nice to meet you in Spanish. So you have a couple of options here. The first one is un placer, which literally means a pleasure. Un placer. Or you could say mucho gusto, which means pleased to meet you or nice to meet you. So un placer and mucho gusto. If you want a bonus longer version, then you can include conocer, which is the verb to meet or to know. And then if it's a man, add lo, or if it's a woman, add la. So putting that together, for example, you could say un placer conocerlo, which means a pleasure to meet you to a man. Or you could say mucho gusto conocerla. All right, so for number 3, we will say my name is in Spanish. In Spanish, they say I call myself. So that translates to yo me llamo. Yo meaning I, and then llamo is the verb to call, and then me is myself. So yo me llamo, I call myself, and then your name. For example, I would say yo me llamo Michael. Yo me llamo Michael. And notice that Y and the double L actually have the same sound in Spanish. So you can think about this as kind of like it's like the J in the word pajamas in English. So it kind of has like a jab. Instead of like yellow, it's more like the J in pajamas. So Joe. Yo me llamo. Yo me llamo Michael. Now you try. All right, so for number 4, this is a phrase to introduce yourself, including your occupation or your title in Spanish. So you could say, yo soy su, which means I am your. That's the formal version of your. Yo soy su, for example, doctor for a male doctor, or doctora for a female a female doctor. You could also say enfermero for a male nurse, or enfermera for a female nurse. And then you're going to see some words that end in ista, which don't change for masculine or feminine. So a male dentist could say yo soy su dentista, or a female would say yo soy su dentista. It doesn't change to like dentisto or nutricionisto or anything like that. If you want to know what your title is, job title is in Spanish, then I've included a link in the description below to a list of many professions in healthcare. And I also recommend using the translator word reference. It's excellent translator to use to find any vocabulary that you want to know for medical Spanish. So phrase number 5 is to ask, how are you? So we could say, ¿Cómo está usted hoy? ¿Cómo está? Meaning how are, and then usted is actually the formal version of you. Some of you might be thinking, wait, isn't you in Spanish like tu, tu? This is actually the informal version, but in a healthcare setting, especially as a medical provider or any healthcare employee, it's a good idea to use the formal version with all patients that enter the facility. So, ¿Cómo está usted? This is for both a man and a woman. Hoy, hoy meaning today. So, ¿Cómo está usted hoy? Super important to include usted in there. If you don't include usted, then this could mean like, how is it today? So they might think that you're referring to like the weather possibly, or maybe their child or their leg, or it's not very specific. So it's very important to include usted. ¿Cómo está usted hoy? And phrase number 6 is a response to that question. So you could say estoy, meaning I am, estoy. And then I've compiled a list here in order from best to worst, so like most positive to most negative responses. So you could say estoy súper, super, estoy súper. You could also say estoy bien, which means well or fine. Then you could say estoy más o menos, which means more or less. Estoy más o menos. You can also say estoy no muy bien. This means not very good, not very well. No muy bien. You could also say estoy mal, which means I'm bad. And then depending on whether you ask the question first or the patient asks the question first, the person responding to say and you would just say y usted. So kind of like estoy bien, I'm fine. And you? Y usted? Estoy bien. Y usted? Alright, so number 7 is a good phrase to use if you're learning medical Spanish and you're trying to use it for the first time with a patient, one of the first times. You could say, thank you for your patience. So, thank you, probably no surprise here again in Spanish, gracias, always followed by the preposition por, which means for. Gracias por su paciencia. Thank you for your, formal again, thank you for your patience. Gracias por su paciencia. And then number 8 kind of goes hand in hand with number 7. Which would be I am learning Spanish. Estoy aprendiendo. Learning, that means learning. Estoy aprendiendo español. I'm learning Spanish. And then number 9 is a good phrase that you can use at the end of the appointment or consultation, which is just have a good day. So in Spanish, they say que tenga un buen día. Which literally would translate to like that you have a good day, or like in English we would say may you have a good day. Que tenga un buen día. That you have a good day. If this is too long for you, then the shorter version, which is very common, you can say buen día, which is just good day. And then the last phrase, which is good to use if you are scheduling a follow-up appointment with a patient, you could say nos vemos, which is literally translating to like we will see each other. Nos is we, and then vemos is we see. So we will see each other, nos vemos. Or a little bonus one that you could use is hasta la próxima. Hasta la próxima, which means until next time. Kind of like until the next proximal, the close time. Hasta la próxima. And again, kind of like in hola, making sure that the H in hasta is silent. So it's hasta and not hasta. Hasta la próxima. All right, well done. You now have 10 important phrases to try out on your next Spanish-speaking patient. I've handpicked the phrases in this list so that you can use them to create a mini dialogue of what that conversation might look like. So what I recommend doing is creating your own personalized version of that dialogue, including things like your job title, maybe your typical response to the how are you question, and then typing that dialogue in the comments below. And I will be more than happy to go in there and make sure it's correct for you to try out on your next Spanish-speaking patient. So great job. I look forward to seeing you all in the next video. Que tengan un buen día y nos vemos.